which carries or impact negatively in the quality of life of women and their families. Many studies have many disorders of the sexual function has been described, but the hypoactive sexual desire disorder is the most frequently presented, and there are few studies in Latin American indigenous women in climatic about these topics. The objective of our study is to estimate the prevalence of sexual dysfunction and hypoactive sexual desire disorder in Latin American indigenous women in climatic. It was a cross-sectional study carried out in indigenous women from Colombia of the ethnic group of the Salud ethnic group who live at 100 meters above sea level, and in indigenous women from Peru of the Quechua ethnic group who live at 3,400 meters above sea level, with ages between 40 and 59 years, and with sexual partner and a regular sexual activity. These women were assessed with the female sexual function index and with a sociodemographic data questionnaire, and the data analysis was carried out with the epidemiological program. A p-value less to 0.05 was considered statistically significant. In this slide, we can see the female sexual function index, which contains 19 questions classified in 6 domains: desire, arousal, lubrication, orgasm, satisfaction, and pain. A total score lower or equal to 26.55 indicates the presence of sexual dysfunction, and a score in the desired domain less or equal to 5 indicates presence of hypoactive sexual desire disorder. This table shows the general sociodemographic data of the studied women, and we can observe that women from Peru were the 66% of the total population, and women from Colombia, indigenous women from Colombia, were the 33% of the population. We can note that the age of the studied women was 47 years, and if we know the average age of the last menstruation, it was 42. So at the time of the study, these women have approximately 4 years since the last menstruation. The most deteriorated domains of the female sexual function index were satisfaction, desire, and lubrication, and the average total score of the scale was 22.8. We found a prevalence of sexual dysfunction of 87%, what is similar to other studies carried out in Latin American indigenous, and we found a prevalence of hypoactive sexual desire disorder of 30.5%. It is higher than what we have found in other ethnic groups. When we compare pre- and perimenopause and postmenopause with the sexual dysfunction and the hypoactive sexual desire disorder, we found that there were not significant differences in the presence of sexual dysfunction in the two groups of women, but the hypoactive sexual desire disorder was higher in women in pre- and perimenopause, and it was a significant decrease with the transition to postmenopause. In others of our studies, we have found that the urogenital domain has been the most deteriorated in the indigenous population, and there are different results and in different ethnic groups.